Welcome to Health Diagnosis. Today we are going to talk about one of the most common yet often misunderstood skin conditions, eczema. Eczema is not just about dry or itchy skin, it is a chronic inflammatory condition that can affect anyone at any age and can have a deep impact on a person's quality of life. Many people live for years with recurring rashes, irritation, and discomfort without truly understanding what's happening inside their body. Let's explore this condition in depth, see what causes it, how it shows up, and what can be done to manage and treat it effectively. Eczema, also known as atopic dermatitis, is an inflammatory skin disorder where the skin becomes red, itchy, dry, and sometimes cracked or oozing. It is not contagious, which means it doesn't spread from person to person, but it tends to run in families. This means if someone in your family has asthma, hay fever, or eczema, you are more likely to develop it as well. Eczema often appears in childhood, but it can also start later in life. The most common areas affected are the face, hands, neck, inside the elbows, and behind the knees, but it can appear anywhere on the body. The skin is our body's first line of defense against the outside world. It protects us from bacteria, allergens, and irritants. In people with eczema, this barrier doesn't work properly. The skin loses its ability to retain moisture, becomes dry, and allows irritants or allergens to penetrate more easily. When that happens, the immune system becomes overactive, causing inflammation, redness, and itching. This leads to a cycle where itching causes scratching, and scratching causes more irritation and damage to the skin. Breaking this cycle is key to managing eczema. One of the most frustrating parts of eczema is its unpredictability. Some days your skin might look fine, while other days it flares up suddenly, becoming itchy, red, and painful. Triggers play a big role in eczema flare-ups. Common triggers include harsh soaps, detergents, perfumes, weather changes, sweat, stress, certain foods, and even emotional tension. Understanding your personal triggers is one of the most important steps in controlling eczema. Let's talk about symptoms. The main symptom of eczema is itching, and not just mild itching, but an intense urge to scratch that can keep people awake at night. The skin becomes dry, scaly, thickened, or leathery over time. In some cases, small bumps may appear that use fluid when scratched. In infants, eczema often appears on the cheeks and scalp, while in adults it's more common on the hands, feet, and behind the knees. Now, it's very important to know that eczema doesn't just affect the skin, it affects the mind too. Constant itching, visible rashes, and discomfort can cause stress, anxiety, and low self-esteem. People with eczema often avoid social activities or feel embarrassed about their appearance. This emotional burden can make the condition even worse, as stress is one of the biggest triggers for eczema flare-ups. So managing eczema requires care not only for the skin but also for the mind. When it comes to diagnosis, doctors often identify eczema based on symptoms and appearance. Sometimes they may do patch testing to find out if allergies are contributing to the problem. There's no single test to diagnose eczema, but a detailed history and examination are usually enough. Now let's discuss treatment and management. There's no permanent cure for eczema yet, but it can be controlled very effectively with proper care. The main goals of treatment are to reduce inflammation, relieve itching, repair the skin barrier, and prevent future flare-ups. The first step is moisturizing. Keeping the skin hydrated is the foundation of eczema management. Moisturizers, also called emollients, should be applied several times a day, especially after bathing. Ointments and creams work better than lotions because they lock in moisture. Always choose fragrance-free and hypoallergenic products. Bathing habits are very important. Take short, lukewarm showers instead of hot ones, as hot water can dry out the skin. Use mild, soap-free cleansers and avoid scrubbing. After bathing, gently pat the skin dry and immediately apply a thick layer of moisturizer. When flare-ups happen, topical corticosteroids are commonly used to reduce inflammation and itching. These come in various strengths and should be used under a doctor's guidance. For sensitive areas like the face, milder creams are preferred. In more severe cases, your doctor might prescribe topical calcineurin inhibitors, which help control immune responses in the skin. In recent years, new treatments have become available, such as biologic drugs that target specific parts of the immune system. These are used for people whose eczema doesn't respond to traditional treatments. Phototherapy, or light therapy, can also be very effective for certain patients that uses controlled doses of ultraviolet light to reduce inflammation and itching. But medical treatment alone is not enough. Lifestyle changes play a huge role in long-term control. Stress management, getting enough sleep, wearing soft cotton clothes, and avoiding harsh fabrics like wool can make a big difference. Keeping nails short helps prevent damage from scratching. Diet also matters for some people. Although food isn't the main cause of eczema, certain foods can worsen symptoms in sensitive individuals. Common culprits include dairy, eggs, nuts, wheat, and soy. Keeping a food diary can help identify any link between what you eat and your flare-ups. A balanced diet rich in omega-3 fatty acids, found in fish and flaxseed, can help reduce inflammation. Drinking enough water is equally important to keep your skin hydrated from within. Home remedies can also support healing. Natural oils like coconut oil and sunflower oil are excellent moisturizers and help restore the skin barrier. Aloe vera gel has soothing and anti-inflammatory properties. However, it's important to test these on a small area first to make sure they don't cause irritation. For people who prefer homeopathic or holistic approaches, treatments often focus on strengthening the immune system, improving digestion, and balancing the body's overall health. Remedies are chosen according to the patient's symptoms, emotional state, and skin pattern. Along with homeopathic treatment, maintaining good hygiene, proper nutrition, and emotional balance plays an important role in recovery. Many patients ask whether eczema can ever fully go away. The truth is, for some people, especially children, eczema can improve with age and even disappear completely. For others, it may come and go throughout life. The goal should be to manage it in a way that allows you to live comfortably and confidently without constant flare-ups. Education is also key. Understanding that eczema is not contagious can help reduce stigma. Families and friends should support people with eczema by being patient and empathetic. Avoiding judgment or comments about appearance goes a long way in helping someone deal with this condition emotionally. Another important aspect is sleep. Poor sleep can worsen eczema, and eczema can also disturb sleep. It becomes a vicious cycle. Taking steps like moisturizing before bed, using soft cotton sheets, and maintaining a cool room temperature can improve sleep quality. If you are someone living with eczema, remember that you are not alone. Millions of people worldwide deal with the same challenges. The good news is that with the right skincare, medical guidance, and lifestyle management, you can keep eczema under control and live a full, comfortable life. At Health Diagnosis, we believe that awareness is the first step toward healing. When you understand your body, your triggers, and your treatment options, you gain the power to manage your condition rather than letting it control you. If you or someone you know is struggling with eczema, encourage them to seek help early, follow a consistent skincare routine, and never lose hope. Skin heals with care, patience, and knowledge. Stay connected with Health Diagnosis for more health awareness, natural solutions, and educational content to help you live a healthier and happier life. Thank you for watching Health Diagnosis. Stay healthy, stay confident, and take care of your skin because healthy skin reflects a healthy you.